Good afternoon, everybody. As Paul said, this is a particular kind of Japanese acupuncture. Is this mic on as well, by the way? Or is it just this one? Okay. Sounds quite loud. It's a particular kind of Japanese acupuncture. And what's very important for us in this style is that we try to understand what is happening with what we know from a Western sense, anatomy, physiology, that type of thing. And we try to understand that in the context of traditional Chinese medicine, what the classics say. And in this particular style, we've got lots of different protocols, and the one I want to just briefly show you today is for the adrenal gland, which is obviously a very, very common clinical finding. Most people are suffering with some degree of adrenal fatigue or adrenal stress or whatever. So for us, it's a very underlying protocol. So it's something those of you who want to can use this type of stuff for more underlying problems and get to the root of things. Before lunch, people were talking about root and branch and that type of thing. So this is very much a root type of treatment. Okay, so obviously we're concerned with symptoms, but we're not only focused on the symptoms, we're looking at the underlying pattern. Okay, so this is the adrenal gland. So we're going to start with obviously a little bit of theory. We're going to look at the Western side of things, which I'm sure you're all very familiar with, so we'll just briefly run through that. Then we'll look at the Chinese concepts and try to marry those two up together and see what we can get from that. And then you might have noticed a couch, so at some point I would like a brave volunteer to come up and be a body. So obviously, come up if you think you've got a particularly adrenal type of pattern, okay? Don't come up if you're totally unstressed, totally relaxed, and you just come back from 3 months in Greece, okay? So if you... Okay, right. Okay, so this is the very commonly used sort of Western understanding of the adrenal stress response, and basically formulated in the 50s by a guy called Hans Seiler, who was a Hungarian physician. And basically, it's his idea of how the body responds to stress. And he categorized it into 3 different groups. So we've got the initial or the alarm phase, which is when you experience a stress. Obviously, the body's put under either emotional, mental, or physical stress as well. The adrenals kick in. You have a response. Where are we? We have a response. And if you follow the blue line, the adrenals kick in. Sorry, it's a bit wobbly. I'm not the best on PowerPoint. But anyway, so the adrenal levels kick in, the adrenals come up, the adrenals come down again. That's a perfectly normal, perfectly reasonable, healthy response. Obviously, if you follow the blue line along, some stresses are bigger than others. So more acute stress, slightly prolonged stress, et cetera, et cetera. Okay, so that's the initial alarm phase. Then, depending on how you are yourself, your own body strength, your own, if you like, resistance to stress, combined with the actual amount of stressor that's coming in. So is it just a single one incident of stress that was quite high stress, but then it's finished? Or is it a continual ongoing stress? Then the body may come into this resistance phase. So instead of levels returning to normal, the body continues in a resistance phase. Okay, and again, that phase will depend on the strength of the stressor itself and your own ability to deal with that. Obviously, some people's stress is another person's, so what, didn't bother me. But so it's always very difficult and depends on the innate strength of the individual, their mental and emotional response. So that's a resistance phase. So if that is prolonged or there's several stressors in a quick succession, then that resistance phase, depending on your own strength, will eventually turn into an exhaustion phase. Okay? And so normally when we see people in clinic, it will either be in the resistance phase where they're going through a huge amount of stress, or it will be, again, very commonly in the exhaustion phase. When people are kind of wiped out, people are actually coming into my clinic now saying, I've been diagnosed with adrenal exhaustion. Okay? So if you see people in this phase or in this phase, then hopefully these type of treatments will help you deal with that situation. Okay? It's a very important thing. So there's 3 different phases. So obviously, as I mentioned already, short-term adrenaline and cortisol reactions in the body are normal, natural, important, and that's a good thing. It's when they're prolonged that other problems start to happen. So decreased immune function, thyroid function goes down, lymph nodes are suppressed, so the immune system suffers. Okay? So if that's a prolonged period of time, then problems start. Okay? And that's, as I say, often where you find people. Now, the adrenal glands obviously are sympathetic. The medulla is a sympathetic part of the nervous system. So if that's active a lot, then it's going to suppress the parasympathetic. So often things for us, like digestive problems, IBS, all that category of things, is very responsive to the adrenal system calming down. And obviously, if the adrenals are overactive, your parasympathetic is suppressed, and therefore it can't work well with digestive functions. Okay, so what else did I want to mention about that? Yeah, in fact, Hans Seyler himself found that the stress that he put his animals under was it's a time-limited thing. Like, as we all know, we can't carry on having stress upon stress upon stress. Sooner or later, we go into that exhaustion phase. And that exhaustion phase is very similar in a sense to our Jing. If you understand what Jing is, our innate kidney energy, our inherited kidney energy. Okay? So if you understand about Jing, and you realize that Jing cannot really be easily replaced, certainly, then you understand that at a certain point, the adrenals also, if that level goes down and down and down, that's very analogous to Jing. Okay, we can't carry on. You will have seen loads of patients, many of us are doing it in our own lives as well, that continual driving force to kind of keep going, keep going, keep going. So it's using up your Jing, which is like your deposit account. So if you use up your deposit account, your stomach energy, your post-heaven chi, is like your current account. But your Jing is like your deposit account. So the adrenals are very similar to that. So it's important not to overstress them for a prolonged period of time, because in a Western sense, it's going to cause immune problems, et cetera, but also in an Eastern sense, it's going to start to interfere with your Jing if you keep driving and driving and driving. Okay. Yes, so briefly the anatomy. The adrenal glands, as you know, are in two parts. There's the medulla, which is the inside, which we just mentioned is very connected to the sympathetic nervous system. And the outer part, the cortex, releases primarily the steroid hormone cortisol. So that's under the influence of the pituitary gland. Now, what's important about these two things is, as we'll see in a minute, that there's a very strong interaction between the two, which is also very much to do with our yin-yang understanding of things. So it's not just yin or yang, there's always an interplay, there's a cyclic movement between the two forces, and each one contains its opposite. So we'll see that in a moment. We also have, the cortex also secretes aldosterone. Okay, so there's another connection there to the kidneys, as we'll see in a moment. So the medulla and the cortex, anatomically and physically distinct, but they do have interactions between them. So the adrenaline is acting on the hypothalamus, which stimulates the pituitary and increases cortisol secretion. So one half is affecting the other half. However, if steroid secretion is blocked, the medulla shrinks. So you can't have one without the other. One's influencing one, but without the other, there's problems. Okay, so that's a very interesting and significant part, and gives us this idea, which you hopefully are familiar with, between the right kidney and the left kidney. Okay, so the left kidney is very much to do with, in Chinese medicine, to do with water. So the adrenals act with the kidneys through the secretion of aldosterone. So they act as an antidiuretic. So we say in Chinese medicine that the right kidney is to do with Ming Men, to do with fire, to do with your yang energy, and the left kidney is to do with water. So we can see correlations here. Now, it may not exactly match what we know, but the ancient Chinese were trying to figure stuff out, and that's what they've done. They figured out that the kidneys have a watery aspect, and then they have a more fiery aspect, and that is perhaps connected to the adrenaline and that movement within the body, the fight or flight response. But there's another connection through the water, so that is also very important. Okay? So we're trying to figure out what's happening with the adrenal glands themselves in relation to what we know in Chinese medicine. 3 Chinese characters for you to have a look at, okay? Because if you're studying acupuncture, then at some point you need to have a look at the characters because there's lots of information there for you, okay? Just a couple of quotes from the classics, which are written just about 2,000 years ago. Ling Shu 28, which is a spiritual classic, so Yellow Emperor, Su Wen, Simple Questions, Ling Shu, Spiritual Pivot. Ling Shu, now as for the very first origin of all diseases, they originate from wind, rain, cold, and summer heat, from yin and yang, emotions, food, lifestyle, if you like, and being severely scared, fright, or sudden fear. So the ancient Chinese have 2 words for fear and fright, okay? And just a little bit of analysis on the character for those of you who like that type of thing. The bottom half of Kong, is the heart. Okay, the bottom half, that's the Chinese symbol for heart. Some of you may know that already. And the top left side, so this little part, not very good with this thing. Oh, there it is. This little part here is a tool for working. And the right hand is something that is holding or knocking or pressing. So it's like a tool. So the idea is it's something that's knocking or pressing on your heart, which is what we all know and we experience when we have an adrenaline reaction. That kind of panting like that. Heartbeat very fast. The character for Jing, for fright, is on the top half, is self-restraint. There's little bits in there, but anyway, the basic of the top half is self-restraint. The bottom half is the horse. So horses are very prone to sudden fright and fear. So you've got these 2 different aspects. So it's the difference between restraint, where you can restrain your fright or your fear, but that becomes fright or fear under the the energy of a horse, if you like. So it's very scatty, very scary, etc., etc. So horses can be quite stable and quite firm, and suddenly they take fright. I'm sure you probably all, in my practice, have seen countless people who have had horse riding accidents. Horse chucked them off, broken collarbone, etc., etc. So that's a very common thing. So there's these 2 different aspects to fear and fright for the Chinese. But what's important for our purposes is that they tie up very nicely with what we already know for our own selves in our own bodies. Okay? Su Wen 39, so Simple Questions, chapter 39. When one is frightened, then the heart has nothing to lean on. Okay, so your spirit is very disturbed. And that comes into all the ideas that we have about anxiety, palpitations, panic attacks, all of that sphere of problems that you see in the clinic, I'm sure, a lot. The heart has nothing to lean on. And the spirit, which must settle in the heart, according to ancient Chinese thought, has nowhere to return. And one's deliberations have nowhere to settle, hence the qi is in disorder. Okay? And this character here is the spirit that goes, or the will that goes with the kidneys, is the zhi. Okay? So we've got the heart underneath, and we've got something firm or something pushing up from the top. So you might think that if this is to do with the kidneys, you would have something to do with kidneys down here. But the idea is more that although your kidneys are what give you your will and your strength from your adrenals, that give you the idea to push on, okay, the actual heart itself, you must have, they talk in boxing, for example, oh, he had the heart, or athletics, they didn't have the heart for it, so they fizzled out. So it's the heart that gives that impetus in order to give your adrenals the idea that they have to push on and push on and push on and push on. Okay? So it's the power that comes from the adrenals, but the initial impetus comes again from the heart. And you can see the 2 heart characters. Is this thing? Oh, here and here. Okay? Here and Okay, so that's just a little bit of the Chinese side of things. I hope you're all following me. You may not be familiar with Chinese stuff, but anyway, I recommend you, if you, have a look at the Chinese characters sometime. There's a wealth of information in there. We just go, oh, bladder 1, bladder 2, bladder 3, bladder 4. We're missing loads of good stuff. And this is very important. And as I say, it gives us this connection to the kidneys, okay, this understanding of what are the adrenals and what is the connection to the kidneys, okay? Because the thing is with the ancient Chinese, they didn't always have the precise detail, but what they had was a general picture, and that general picture, in my nearly 30 years experience, is very, very seldom off-piste. It's always there or thereabouts. So it's very important to understand the root of these things. And as I say, hopefully, the adrenal pattern itself will give you good tools to think about treating the root of people. Okay, so that's all the theory and stuff. That's the kind of behind that. Is there any questions? Do we just have questions at the end, or? Question. Okay. I just hate people to sit in there. I don't know what he's talking about. Anyway, okay. So this is a particular protocol which I hope you can at least have a look at, even if you don't particularly want to use it immediately. It may be not particularly what you want to do. But this is a kind of common etiology for the adrenal glands. Okay, so lifestyle, we've talked about already. So overwork, stress, etc., insufficient sleep, drinking, drugs, obviously, anything that's going to hammer the kidneys. So for the Chinese, the kidneys and the adrenals are kind of one thing. So we can divide them slightly, but as you can see, I hope, from everything we've talked about so far, some of the functions that we know are part of the adrenals are what the Chinese ascribe to the kidneys. Okay, so they both tie up together. Okay, so chronic tiredness or exhaustion, that's obvious. Stress, physical, mental, emotional stress, and as we said, particularly if it's prolonged, or particularly in this style of acupuncture, we say if there's 3 very big stresses, particularly life-threatening trauma or close to life-threatening trauma in quick succession, that can really make your adrenals take a nosedive. Okay? So, there we are, feel a shot. So, sorry, I keep kicking this thing. Chronic inflammation, other hormonal imbalances, okay, affecting the adrenals, particularly the thyroid. So you must see lots of patients with thyroid problems. So that can be affecting the adrenals. Obviously, there's something going on with the pituitary gland. That will affect the adrenals. Surgical operations. For some people, again, it's so what? I had a surgical operation, fine. Other people, it's very, very traumatic. It's a big deal. You know, even a smallish operation is quite a big deal for some people, and other people, so what? Obviously, genetics plays a factor, as it does in everything. What's your inherited strength? How strong are you from the beginning? That's important. And then steroid hormone use will definitely affect, obviously, the adrenals and the kidneys. External cold, and unfortunately for men, excessive sexual exercise or activity, we say. So that of course, declines your jing and therefore your kidneys. Bad luck, guys. Okay, so signs, symptoms, and indications. There's a whole raft of stuff there. But basically, you can kind of categorize them, if you like, or group them, let's say, better. Okay? So we've got the first lot, which are basically simply tiredness. So tiredness, exhaustion, poor libido, impaired fertility, a decline in kind of general energy and sexual function. Okay? Then we come on to things like prolonged or minor illness. So again, you'll see lots of patients, I'm sure you already are, who don't just get a cold and then get over it. That cold has been dribbling on for a month, 2 months, 3 months, that type of thing. So if you hear that, you might want to think about this treatment and having a look at it. Okay, because it's not, now we're talking about the roots. So why hasn't this cold cleared up in a normal person? That cold should clear up straight away, shouldn't it? In a week, you should be better. If it's not better in a week, there's something else that's going on, so we have to look at the root. Then, as we mentioned before, this nervousness, panic, the heart is unsettled. Why is it unsettled? Because the water energy is not calming the heart. Okay, so you need the good, strong adrenals, good, strong kidneys in Chinese medicine to calm the heart. But if you're continually adrenalized, as we often are in society today, because, you know, maybe 30 or 40 years ago we were worried about the bomb, well, that's kind of receded, but now there's all sorts of other insidious stresses creeping in all the time around us. So I think many people actually suffer from some degree of adrenal fatigue, kind of irritation, or a drip, drip, drip effect on your adrenals, which carries on and on and on. Okay? There's, you know, the environment, terrorism, there's these things kind of floating which make us all slightly more stressed than perhaps we really should be. Okay? So these what you might call yin deficient type of symptoms. Okay? If the yin is deficient, the yang will be excessive, and therefore it will disturb the heart. Okay? So things like PTSD, limb pain, etc., phantom limb pain, can all be addressed through this adrenal treatment. So some of you I know, well, in the past when I was here, work with military people and stuff like that. So if there's people who are treating military people and they've got PTSD, this adrenal treatment should be helpful. Okay? And we're going to show you how to diagnose it in a moment and treat and stuff. Okay? Again, more yin-shu symptoms. So around kind of menopausal time, the hot flushes, night sweats, etc., is a yin deficiency. So you need to strengthen the kidney energy in order to strengthen the water and calm down the fire. Okay? And obviously, things like osteoporosis, the kidneys and bones are tied together for us in Chinese medicine, kidney and bones. You're all aware of that, right? I see a couple of people nodding. Anybody not aware of kidneys and bones? No, okay, good. All right, okay, fine, just checking. Okay, so kidneys, bones, and then we've got all the common things that are associated with kidneys. Bones we just mentioned, ear problems, teeth, all of those things. So gums, you know, he's long in the tooth, gums, your kidney energy is receding, as are your gums, therefore long in the tooth. So all of these things which are common TCM syndromes as well. Unclear thinking, again, brain and kidney, very, very related. Yeah? Your marrow, in Chinese medicine, your sui, comes from your kidney energy. So brain, unclear thinking, muddled thinking, etc., you want to think about the adrenals and the kidneys. Lower back issues, obviously, kidneys, lower back. Irritability, your liver is not nourished by the water, so 5 elements. Those of you who like 5 elements. Cold or weakness in the lower area. Lack of appetite. Again, the sympathetic has suppressed the parasympathetic nervous system, and digestive problems. Okay? So that's not an exhaustive list. It's quite a long list, but it doesn't mean that those are the only things that may show up from an adrenal pattern. Okay? There's lots of different things. How will you know if your patient's got your adrenal pattern? Ta-da! You'll do a diagnosis. So you will check, has your patient got an adrenal pattern? So you will have your suspicions. This person has an adrenal pattern because they've got 5, 6, 7, 8 things, or even 1 or 2 things that will suggest that they've got an adrenal pattern, and then you'll check. Okay, and this is how we check. Okay, so that's an abdomen, and our diagnosis for well, I'm not the best at drawing either. If you imagine the navel as a clock, with 12 o'clock at the top, 6 o'clock at the bottom, 3 o'clock, 9 o'clock, okay? Therefore, we call this adrenal reflex, roughly, to give you an idea, 4 o'clock, 8 o'clock, okay? So it's in that zone, okay, close to the navel. It doesn't have to be precisely 4 and 8. It could be, you know, 3:15, 20 to 9, you know, something like that. However, what you want is you want to be close to the navel, and you're going to diagnose in under the navel, and we're going to show you in a second with the camera and stuff, so you'll be able to see clearly. Okay? So that's your major diagnosis on the front. So if someone has that reflex showing when you press a tummy, which should be easy for you guys because you're all physio, so you're used to grabbing hold of a body. Sometimes if I say this to acupuncturists, they're just used to taking the pulse. But you get in there with your hands, don't you? So you can easily diagnose. It's not a foreign thing to you, okay? So that's a major diagnosis. One other diagnosis is we check, in this particular style, we check kidney 2. Kidney 2, why do we check kidney 2? Kidney 2 is the fire point, okay, on your channels. You have 5 element points on your channels. Kidney 2 is the fire point. Therefore, if there's any irritation, inflammation, either in the channel itself or in the organ, okay, then we consider that, inverted commas, fire or inflammation. And that will show in the fire point. Okay, so if you squeeze kidney 2, you'll find that a lot of people jump off the table because it's a lot of people are in that place. Okay, then for those of you who like pulse, we also can check the pulse. So we've got 3 different ways to check if the adrenals are not as they should be. Okay, so a rapid, thin, and tight pulse, like ting, 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 will be in the initial stage. Possibly in the resistance stage as well. If they're up high for a long period of time and they're very adrenalized and they're on the go, this rapid, thin, tight pulse will be there. So it doesn't matter the position necessarily, but you'll hear that ting, or you'll feel that ting, 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 like that. Sinking and slow pulse is going to be in the deficient zone. Okay? Or you can check the kidney position itself, right and left, so third position, and markedly weak. Okay, so any of those things, any or all of them, or just 1 or 2, might indicate that you've got an adrenal pattern. Okay? Okay, on the back of the body, we're going to check the Huatujiaji, which you're all familiar with. Thank you, David. Okay, Huatujiaji, are you familiar with that? Say yes, Andy. Yes, Andy, good, okay. Okay, so Huatujiaji of Ming Men, okay? Why Ming Men? Because it's the gate of life, kidney fire point, okay? Or linked to kidney fire, okay? I've drawn a slightly larger sausage there, so you can actually check around a little bit, okay? Looking for pressure pain, okay? And I've made a little note on the side there. It's particularly important if you've got patients that have frequent miscarriage. Ming Men has to be in great shape. Okay, so check Ming Men very, very carefully. Okay, so that's a diagnosis, okay? Because the yang energy of heaven, ancient Chinese, has to come down to attach to the embryo, and that comes through Ming Men. I know you're all physios, but this is ancient Chinese. It comes through Ming Men, attaches to the fetus, otherwise the fetus may come out. So Ming Men has to be in great condition. That's what the ancient Chinese say, which is interesting, I think. Okay, I hope that's all clear. I hope you're getting ready because I'm going to need a body soon. Some brave soul. Okay, let's have a look at the treatment points that we can use. So, on the front of the body, you're primarily going to use kidney 6 and kidney 27. So all you have to remember is it's something and 27. It's a dead easy treatment to remember. It's something and 27 because they're all something and 27. Okay, it's a dead simple treatment. Okay, so I'm going to. So let's just talk about the front of the body for a moment. So kidney 6 and kidney 7. That's your primary choice. Okay, so if you're in a bit of a I'm not sure, you can check about kidney 6 first, okay? And how you're going to check is you're going to diagnose the abdomen, okay? You're going to, before you stick any needles at all, you're going to massage kidney 6 and see if it's working. Is it going to work? Who knows? It should work, that's the theory, but of course there's the theory and there's the practice. It doesn't always work, okay? So when Mr. Smith or Mrs. Smith is sitting in front of you, you have to figure out, is kidney 6 going to work for them or not? Okay? So kidney 6, 27 is your kind of go-to initial treatment, if you like. Okay? Then we've got second treatment options because obviously kidney 6 doesn't always work. Okay? So you've got other options here, which I've listed here. Just because we haven't got much time, so I've just listed the main ones, okay? But there are others. Okay? So Diagnosis of kidney 2, which we've already mentioned. Okay, so you're going to squeeze kidney 2. The prescribed amount is 3 kilograms of pressure. Okay, so you can get your kitchen scales out, close your eyes, 3 kilograms. Oh, yeah, it is. Okay, so you can check. Roughly 3 kilograms. It doesn't have to be, roughly 3. It's a good squeeze. Okay, so, oops, this thing is, I'm not used to it. Okay, so, if kidney 2 is painful, okay, you're going to treat 7, 10, and 27. Okay, why 7 and 10? Because 10 is the water point, 7 is the metal point. So your first day in your acupuncture class, you did 5 elements, right? So water, through the genius of Oriental medicine, water puts out fire. What supports the water? Metal. It's your first basic, simple 5-element class that you did way back when you started doing traditional acupuncture. So 7, 10, and 27. Okay, so these things particularly, so if your patients have ovarian problems or hyperthyroid problems, rapid pulse, or if you've had radiation therapy, then kidney 2 is likely to be painful, and then kidney 7, 10, 27 will be a good choice. Okay? And ovarian problems, because in our style of acupuncture, I'm not sure about TCM, but in our style of acupuncture, the ovaries belong to kidneys. So if you hear an ovarian problem, we go straight for the kidneys. Womb belongs to liver. That's a different... This thing is driving me crazy. Okay, so ovarian problem. Now, if it's just a bone problems, we're talking a lot, I think, Giovanna was talking before lunch about arthritis. Okay, so if you've got people with arthritis, rheumatoid or osteo, you want to think about kidney 7 and 27. Okay, because kidney 7 is our bone point. Okay, bones. Okay? And tension around the Daimai vessel. So as physios, you must see tons of people with twisting injuries. Sports people, I don't know, footballers, whatever, twisting injuries, car crashes, twisting injuries, all that type of stuff. If you've got a twisting injury, the girdle vessel, Daimai, is affected. Okay? So the way to release Daimai, one way, is kidney 7. Okay? So Daimai, the girdle vessel. Okay? Kidney 9, so if you've got an elderly patient or someone with a medical kidney disease, then you might want to pick kidney 9 first. Okay? Or someone who's on strong medication that's affecting them, then you might want to pick kidney 9, 27. Okay, it's one of our, kidney 9 is one of our detox points. Okay, and lastly, a big one, kidney 3. So kidney 3 for the chest. Okay, so asthma, where it's difficult to breathe in. Well, there's asthma, breathing out asthma, and there's asthma, breathing in. So we have 2 different kinds. Okay, so this is for breathing in asthma, kidney 3, which is probably more common, but yeah, kidney 3. So asthma breathing problems, especially on inhalation. So if you've got people with COPD, etc., then all the energy is stuck up here. So kidney 3 does a great job. Obviously with other lung points, etc., okay? This is just a tiny slice of the cake, okay? So, and if you have hypothyroid, so kidney 3. Okay? So those are our secondary treatment options. And I stress, how will you know which treatment you're going to choose? You're going to massage the point in this particular style. You massage the point before you stick the needle in, so you know if it's going to work or not. Okay, which, as I say, for you guys, physios, should be great. Love massaging bodies and prodding and stuff and checking it out. Yep, when you're massaging, I'm expecting, so when I'm diagnosing, does anybody want to be a body? Lady at the back, brave soul at the back. Step right this way. Should we give her a little round of applause? Do we not have any couch roll? Couch roll? That'll do. Okay. Could you, sandals off, please? And if you pop your head here, face up. Yep. If you want to give me those bits, I'll pop them on the table for you. Lying down, head here, face up. Yep. Okay, what's your name?
Angela.
Angela, okay. So Angela's bravely, I hope you can see now. Yep, that's great. Okay, is it all right just to lift here a little bit? Okay. Okay, so the area we're going to diagnose is going to be 4 o'clock and 8 o'clock, okay, more or less. So what I'm going to do is I'm just going to press in, and yeah, she already has like a massive pulse here. And I know you're going to say abdominal aorta, but it's too big. It's pounding. We say Ming Men is pounding, which means her body is doing too much work for the amount of energy she's getting out. It's like when you're cycling and you change gear and you slip until you engage the gear again. Okay, so let's have a little check. Is that tender? Sorry, so I'm looking for pressure pain. Was it somewhere over there, the voice? Yes, that lady there, yeah. So I'm looking, as I press in and push under, I'm looking for pressure pain here. Okay, so I'm asking, from my side of the coin, I'm looking for tension, tightness, hardness, etc., etc. From Angela's side of the coin, she's giving me feedback and saying, yes, that's tender or not, as the case may be. Okay, so you can check a couple of locations, see which one is tender or more this one, right? That one, okay. Normally I'd have a little pen, but I've forgotten my pen. Has anybody got a little markery type thing, or an eyeliner I usually use, actually? It's just a little tiny dot so you can see where we are. If I put my glasses, I can see too. Okay, so on the other side of the body, you can come around to the other side, but I won't because I'm going to be plumbing the way of the camera. So, but you can just change your angle a little bit and push in underneath here. Not as bad as the other side, but something. Here, I'm checking a couple of locations. Here, that one there, okay? So again, I'm going to put a little dot, there we are, just where I find stuff. Okay, then, that's my diagnosis. So I could check her pulse, but that won't help you because you can't see anything, okay? So that doesn't really help. And kidney 2. So I'm going to squeeze kidney 2. You want to jump to this one? Yeah, I'm going to squeeze kidney 2, see how she feels. Ow. Very common. How about this? Ow, double. So left was worse, left kidney 2 is worse. This was less and less, okay? But still something, okay? Right, so can I pull this trouser up a little bit? Yeah. Is it going to go above the knee? I might need both, yeah. Don't forget, if kidney 2 is painful, I need to do 7 and 10, so I need just above the knee. Okay, so before I stick any needles in, what I want to do, wait a minute, this side was worse, yeah. So I'm going to check, can you see, camera guy? Oh yeah, great. So kidney 7, okay, kidney 10 behind the tendons. Okay, so you massage a little bit just to check that something's happening. You need to check that something's happening. Okay, so chum, 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 chum. Okay, then recheck and see how she feels. Not as bad, yeah. So that's what we want. That's the answer to your question there, lady there, is I'm looking for some substantial change in her response, okay? So that means that I'm on the right point and I'm doing something, okay? Because otherwise I might not. If I started kidney 6, that may not work so well, okay? So just to recap, I'm treating kidney 7 and 10, which I hope you can see. So, yeah, kidney 7, kidney 10. Okay, so I'm just massaging, make sure they work. Okay, massage, 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 which is the key to what we do in this style. Okay, we don't just whap needles in, we massage, 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 then quickly we recheck, make sure it's okay. So you check into the same depth. How much change? Massive. Massive, okay. So if someone says massive, what did I just do with those needles? So then, what you will do in this particular style, okay, so obviously you don't have to learn the whole style today, but you're just simply going to follow along exactly, you're okay to needle, right? Yeah, okay. You follow along exactly with what you've just found with your finger. You hit the middle of your fingerprint, or, obviously a needle's much thinner than a finger, but you'd go into the depth. Can you see that? Okay, so, boom. Okay, so that's those two. Then we recheck, make sure change or no change. How much change? A lot. Less than my finger or same?
I mean, compared to the first time you
Yeah.
did it, much less.
Much less, okay.
You kind of went to the other side a little bit.
Other side a little bit, okay, we haven't done the other side yet, okay. So let's add kidney 27. So this is what you would do for your adrenal treatment. Simple. Kidney 27, hard to see. Kidney 27, any case, you're going to angle towards the sternum. So quite shallow insertion, but towards the sternum. So 10 degree towards the sternum. Can you see that? Sorry if I pull. Can you see? No. A bit difficult. Anyway, you know where 27 is, so 10 degrees towards the sternum. Okay, and then they'll just sit. Adrenal treatments, you need about 20 minutes. Because they're the deepest, kidneys are sort of energetically the deepest organ, and they're deep within the body. So let's try this side as well. So 7, 10. Normally I'd come around the other side, but I won't because of the camera. So find kidney 7, slide into kidney 7. Kidney 10 is sometimes a little bit tricky because the tendons are a bit difficult, but anyway, a bit tender here, I guess. Okay, then massage, 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 and recheck. Very different. Okay, great. So that's what we're hoping for. So I just pop these 2 needles in here, and that would be your adrenal treatment. So then, if you wanted to then go on and work on other things that were relevant for your particular person, then you can do that. So those needles can sit. Oh, we haven't done, did we do 27? No, we didn't. Then, boom. Okay, then, simple. Obviously, in clinics, you may not be wearing a T-shirt, but okay, and there we are. So to go back, so if 7 and 10 hadn't worked, then I have other choices that I can choose from. Okay, so that's what we're looking for. We're looking for some degree of change within the patient's body. Okay, you may not get quite as good a change as that always, but if you get 30, 40, 50%, that's not bad. Yeah, decrease in pain, decrease in sensitivity. Yeah, I mean, the patient may report all sorts of different things. She may report something like, oh, it feels a bit weird, I feel nauseous, it's uncomfortable, there's referred pain to a different area of the body. So any of those things that the patient reports, you want them to calm down when you check your points. Yeah. If it's only one side, you would probably only treat one side, but that would be unusual. Yeah. It's possible, but yeah, anything's possible. But yeah, you would normally treat both sides, yeah, together. Yeah. So it seems very simple, and it is very simple. This is obviously only one slice of the cake, and it doesn't mean that, if you treat the adrenals, then, this whole list of stuff will just vanish in 2 seconds flat, okay? What it means is that it's an underlying root treatment, okay? So if you're stuck with patients, and they've got, as we mentioned, injuries are not healing properly. I mean, lots of you must be treating sports people, et cetera, et cetera. If those injuries are not healing, then you have to ask, why are they not healing? Okay, one possible reason is the adrenals are compromised. Okay, so all of those type of things, you will of course add your own treatments on top of that. This will not necessarily be sufficient, but as I say, if you're looking for a root treatment protocol to get into the adrenals and try and sort them out, then this is a great way to do it. Okay?
With the thyroid itself, if you divide the thyroid and you go for these kind of points, it's high code.
Yep.
You then switch to...
Yeah, I would switch to whatever it is, yes. I would check the thyroid itself. Yeah, I check the adrenals and I check the thyroid itself in that case, yeah, to make sure it's going to work, yeah. So definitely, yeah.
You mentioned that you described the left kidney to the water, the right supply. Did you ascertain any significance to the difference in symptoms from left to right?
Yeah, well, definitely Angela's left side was much worse. So, I mean, obviously I don't know her, but if she was my patient and we'd done a full case history, then there may be things within that that would correlate with that. I don't know, maybe she has slight weakness of bladder, or, you know, there may be water-type symptoms within that. Or it may be, you know, there's maybe other, you know, menopausal symptoms. There may be other things that you would ascribe to water. Yes, definitely. Yeah. So these are just kind of indications. All this is, that's why I put signs, symptoms, and indications, because, you know, it's just a possibility. These are possibilities that you may come across. You don't have to have all of them, obviously, okay? But it's just important, if you're stuck with things, as Giovanna was saying before lunch, you've got to get to the root, and this is one root. I mean, there's no more root in Chinese medicine than kidneys. That's your inherited ancestral energy. There's no more rooty than that. It's your deposit account. It's your long-term savings. That's your jing, that's your adrenals. And this is one way, and I hope you've been able to see the correlations between what the ancient Chinese believed were, you know, your jing, your essences, and what we also know as kidney function and adrenal function. Okay, so there's some, not exact correlations always, but very close correlations, which are fascinating. This particular style of acupuncture, we do a lot of that sort of thing. Yeah, we try, because you can't ignore Western medicine, obviously. I mean, I'm a traditional acupuncturist, and it'd be easy for me to just, you know, knock it out the ground. But actually, for example, the pituitary doesn't exist in TCM. Neither does the pancreas. So what do? We have to figure something out. You can't just go, well, ignore the pancreas, or just stuff it in with the spleen. We can do that, but it's, you know, it's a different thing. You know, probably when the ancient Chinese were cutting people open, they just saw the pancreas, and it's like, I don't know, you know what I mean? It's not a clear organ, is it, like a heart or a liver? It's a bit of a squishy, funny organ, the pancreas. So they maybe just thought it was a bit of fatty tissue. And some of the ancient drawings do have layers of fatty tissue in them. Anyway, I digress. Yeah, so, okay. Any more questions? I mean, you can ask general questions later, and probably the other guys, maybe you want other questions. All my timekeepers come in as well. No? Is it? Yes?
What if you had some kind of surgery when they were unable?
Yep.
Affect the diagnosis?
Yes, it may well do, yeah. Scars and stuff was actually something I talked about here a couple of years ago. But yeah, so laparoscopy will not necessarily affect the adrenals, but in terms of like location, because it'll normally be more central. But definitely something like a laparoscopy is definitely a candidate for using an adrenal treatment, because a laparoscopy operation by its very nature is stressful. And often women have had 2, 3, 4, particularly you were talking about male infertility, but if it's female infertility, they may have had 2, 3, 4 laparoscopies, which is a big operation, small scale, but big operation. So yeah, that's definitely potentially traumatic. The navel as well for us falls under spleen, so we would treat spleen points for that as well. But yeah, the adrenals, yeah. If there's stress involved, you know, on a simple operation, you know, it can be very stressful for people. You know, particularly any kind of general anesthetic, people are not keen on that at all. It's a very stressful situation. Okay, well, I've got a patient here. Hello. Okay, so just take these patients out. I just want to show you quickly, am I done, Paul? I was just going to show you quickly the back of the body. Have a look at your diagrams. The prone position, you're going to diagnose the Huatou Jiaji of Ming men. So L4, okay, is level with the hip, more or less, so you come up a tiny bit, and the Huatou Jiaji points, you're going to press in towards the center. How's this feel? Tender, yeah. So again, the same principle is going to, here. Oh yeah, okay, great. So teeny spot. I always find it good to mark the spots, Because otherwise, when you change, the patient says, no, 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 you're not on the right spot. And you say, oh, but I am, because I've marked it. Here. Yes, both. Okay? So you would do exactly the same thing on this side of the body. If you look at your points that we're choosing, the points would be gallbladder 25 to try and change this. So you would massage, let me show you from this side, yeah, can you see? Yeah, massage gallbladder 25, boom, sorry, here, sorry. Gallbladder 25, and then you'll, where's my spot? Oh, that biro didn't really work. Anyway, and then you're going to recheck this point. Some change or not? Some change. So again, and then you're going to needle again. So you've got to make sure you're on gallbladder 25 because it's a tricky point to find. Okay? So this way of working, I hope, will appeal to you physios because, as I say, it's a very hands-on method of working. And you have to find the point. I mean, where is her gallbladder 25? You've got to find it for her because she's not one of those anatomical Chinese charts where everybody's in perfect proportion. You know, she's a normal human being with, you know, not in perfect proportion. I mean, I'm not, you are imperfect, but you know what I mean. Yeah. So, so you have to find it, and the way to find it and make sure you're doing something is check the back with the diagnosis. Okay? So that's the fundamentals of what we're doing. Okay? So that's a very brief whiz through the adrenal treatments. I hope it's been some use for you. It's given you a little inkling, and as I say, it's a very great root treatment protocol. So please take it away, try it on Monday morning in your clinics, and have a little go. It's dead simple. Okay? Right, thank you.